Hello friends, in our previous video we have seen the concept of inclusive education. In inclusive education system, it involves normal students with different social, economic, cultural background and special needs students. That means students with different disabilities. So there are different types of disabilities. So let us understand which are the different types of disabilities through this video. Before going to understand the types of disabilities, let us understand the concept of impairment, disability and handicap given by the World Health Organization in 1976. Impairment is concerned with abnormalities of body structure and appearance with organ or system function. So it represents disturbances at the organ level. Disability reflects the consequences of impairment in terms of functional performance and activity by the individual. It represents disturbances at the level of the person. Handicap is concerned with the disadvantages experienced by the individual as a result of impairment and disabilities. That means it reflects interaction with and adaptation to the individual's surrounding. There are different types of disabilities: hearing impaired, visually impaired, orthopedic impaired, cerebral palsy, mentally impaired, learning disability students, autistic students. So we can bifurcate all these type of disabilities in sensory disabilities, physical disabilities and intellectual disabilities. So let us understand the first type of disabilities, that is visually impairment. Visual impaired children may be defined as those children who suffer from the impaired conditions, difficulties and deficiencies present in the organs which make them different from the children with normal vision to extent of requiring special education provision. Visual impaired students may be of low vision, legally blind, partially sighted or totally blind. Visual impaired is defined in terms of visual acuity, field of vision and vision of efficiency. Visual impaired is a condition in which student's vision is deficient to such a degree that it significantly affects his school functioning. Let us understand the definition of visually impaired child medically or legally, which is given by American Medical Association in 1934. A legally blind person is said to be one who has visual acuity of 20 by 200 or less in the better eye even with correction, or whose field of vision is so restricted that it sustains an angle of 20 degree or less in the better eye even after correction. So friends, this is a Snellen chart which is developed by Dutch doctor Herman Snellen in 1862. You might have visited to the ophthalmologist clinic and you might wonder why this doctor is asking me to read these letters. But reading this letter decides your visual acuity. Nowadays, many ophthalmologists and vision scientists use logmark chart to decide the visual acuity of the person. There are different levels of impairment: mild visual impairment, moderate visual impairment and severe visual impairment, that means total blind person. Vision is the most active sense organ of the human being. Visually impaired children are experientially deprived in terms of range and variety of experiences. So there are different characteristics of visually impaired child. So cognitive characteristics: visually impaired child not necessarily intellectually retarded, but they may perform poorly on standard intelligence test. Most of the concept normal students can learn through the visual means, and as visually impaired child have lack of visual sight, so they may perform poor on standard intelligence test, or academically they may perform poor. Then physical characteristics. So physically these normal students and visually impaired students may be similar, or in size and appearance they are same. Low vision and blindness may impact movement and the quality of motor skills. Behavioral characteristics. These visual impaired children are not able to see non-verbal communication, non-verbal understanding and body language. Also, they are facing problem in communicating with each other, as they cannot see, they cannot read, they are having difficulty in reading, they are difficulty in understanding body language. So, they are facing problems in communicating with each other. Now, in our class, we have different students. Now, how to identify these visually impaired students from other students? So, the students are having complaints of headache oftenly. They blink their eyes frequently. They hold object very close to their eyes. They covers one eye and tilt the head forward. They rubs their eyes excessively. Their eyelids are very smaller. The pupils of the eyes are of different size. Their eyes are very sensitive to light and oftenly watering of eyes. They experiences difficulty in moving around the classroom, as they cannot see properly like normal students. They faces difficulty in reading small print material. They take false steps while walking. Their eyes are squint eyes. They are inattentive during reading session, as they cannot see, they cannot read the things, and they complains dizziness after reading. So there are different educational provision for this visually impaired students. Use of remaining sight. So these partially sighted students always advise to use their residual or remaining sight. We can use closed circuit television, magnifying glasses, large print material, so that partially sighted students or low vision students can see and they can read the materials. We can also use the braille lipi, as these visually impaired children cannot see. We cannot use the visual aids to teach these particular students. So we have to use audio aids. So talking calculator, tape recording. Also, we have to use the curriculum which is modified, which meets the needs of this visually impaired child. So we can use the plus curriculum and different co-curricular activities. To teach this visually impaired child, teacher can use the following strategies. Teacher can encourage to use visual aids like large print materials, magnifiers, and using braille lipi. Seating arrangement of visually impaired children should be in the middle and towards the front of the teacher. Teacher should ensure the light which is coming to the visually impaired children should be from behind or to the side of the student, not from the front of the student. Use of large print and magnified worksheets. Print materials should be clear and dark, and we should use verbal descriptions. We should increase oral activities, as they cannot see. We have to use the or increase oral activities, increase hands-on experience. We should give them more time to complete tasks, provide mobility and orientation training, as they cannot see, they cannot move around the classroom. So for moving around the classroom, we should provide them with the mobility and orientation training. We should give them a peer to help, or a friend, or use buddy as a guide, or we should call them by their name when we want to seek their attention. Hope you understand visual impairment concept, which are the different strategies we use for teaching this visual impaired child, and how we can identify this visual impaired child from different students. Thank you.